My name is Shannon Bova, and this is the story of my 3-year-old son, Reece. At a routine doctor's appointment during my 38th week of pregnancy, a pregnancy that was free of complications or any indication that anything could be wrong, at that appointment it was realized that my blood pressure was a little bit too high, and that day was going to be the day that we were going to have our baby. Like most parents, we went to the hospital expecting to experience laughter and joy and happiness, and what we experienced was something much different. Reece was born on March 2nd, 2012, silent, limp, and very blue, and lacking any sort of signs of life. Reece was born with a congenital heart defect called tetralogy of Fallot. That defect presents with 4 defects of the heart. Typically, kids with tetralogy of Fallot have their open heart surgery, their repair, and tend to live a fairly normal life. Other than maybe some extra doctor's appointments here and there, they tend to grow up and do just fine. Reece did have an open heart surgery in December of 2012 at the age of 9 months. The surgery was considered a success, but for some reason Reece was not healing properly. He was having a hard time, his heart was having a hard time adjusting to the new function that it was given. Reece was having a hard time healing, and we weren't really sure why, and neither were his doctors. So in February of 2013, Reece entered the cath lab again, and it was determined there that he also, in addition to the tetralogy of Fallot, suffers from severe peripheral pulmonary artery stenosis. So the arteries in his lungs are just way too small, which is causing his heart to work extra hard. To date, Reece has had 2 heart surgeries, 9 heart catheterizations, and he's been intubated 14 times. Because of the severity of his disease, we were told by those surgeons that there was really nothing else that could be done. They told us to take him home and let him be a kid until he couldn't anymore. Unable to accept that answer and not give up on him, we worked with his local cardiologist, and we sent his medical records all over the country to large, world-renowned facilities in hopes that someone there could help him. And almost all turned us away, except Boston Children's Hospital. We had many conference calls with them to discuss Reece's disease, what he would need, the risks, but what the potential outcomes could be. And that day, we made what we felt was the easiest, most difficult decision, because we knew if we didn't go to Boston for these procedures, we knew that his heart would fail at a young age. But we know if we moved forward with them that the procedures are extremely risky, and the potential for something terrible to happen in the operating room is always there. So we traveled to Boston Children's Hospital a couple of times a year for life-saving procedures for him. We've been there 4 times in Reece's 3 short years of life and have been successful all 4 times. The pressures in his heart are continuing to decrease, which is what we're trying to do, to decrease the pressure in his lungs so his heart doesn't have to work so hard. Because of organizations like the American Heart Association, there is funding for research, and there is funding to help kids like Reece have a chance at life, to give the family and the parents hope that their child is going to be okay. That while this is all very scary and sometimes just seems really unfair, that there's organizations out there like the American Heart Association that are helping children like Reece. Myself, Matt, and Reece want to take this opportunity to say thank you to the American Heart Association for allowing us to share Reece's story and to help spread congenital heart defect awareness. Thank you.